Hi, I'm Ryan Xue.
And I'm Lauren, and we're going to be talking a little bit about AIDS and how it can affect education.
How this issue could affect the classroom in each country, like China, Africa, American. Yes. According to research, children often by AIDS may miss out on school enrollment, have their schooling interrupted, or perform poorly in school as a result of their situation. And studies suggest that the impact of orphanhood on a child education is closely interlinked with other factors such as poverty. For example, a multi-country study released in 2010 found that orphanhood itself was not directly associated with lower school attendance.
Instead, other factors like greater household wealth were more likely to result in increased school attendance for both orphans and non-orphans. But the loss of a productive family member through a child being orphaned is likely to be a huge financial burden, and it might push a family from the middle class into poverty, and that would increase the likelihood that this child, orphaned by AIDS, is going to miss out on school. And one of the consequences for AIDS orphans in Latin America is that they often end up homeless, and these homeless street children really do create crime, and they're a really big cause of civil unrest. According to a study turned out by The Economist, orphans are far more likely than other children to miss school, turn to begging or prostitution, fall sick, fail to be inoculated, that means given their vaccines against disease, pass on diseases, and die young. And in the United States, children often care for their parents at the end of their lives. This is an emotional burden, and without parents to advocate for counseling and support, AIDS orphans are left emotionally scarred, and that emotional scarring can lead to less resistance to disease and greater ability to common diseases. Without parents to help pay for college or support children in high school, AIDS orphans in the Americas don't have the support to complete vocational training or college, which can mean depressed wages for the rest of their life, which does have physical consequences in very class-bound societies such as the Americas.
And always, the AIDS orphans have very low nutrition status. According to a survey in China in 2005, showed that approximately 14% of boys and 15% of girls aged from 6 to 12 to 22 have like different degree of anemia. However, like approximately 50% of AIDS orphans were anemic, which showed that in the nutritional status of AIDS orphans were much poorer than the national level. And in Africa, the loss of a parent to AIDS can have a serious consequences for child access to basic necessities such as shelter, food, clothing, health, and education. Lack of income puts extra pressure on AIDS orphans to contribute financially to the household, in some cases driving them to the street to work, beg, or seek food.
Now we're going to discuss some of the psychological consequences of AIDS orphans.
Yes, children whose parents are living with HIV often experience many negative changes in their lives, and can start to suffer neglect, including emotional neglect, long before they are orphaned, and may suffer exploitation and abuse. In one study carried out in a rural Uganda, high levels of psychological distress were found in children who have been orphaned by AIDS. Anxiety, depressions, and anger were more found to be more common among AIDS orphans than other children. 12% of AIDS orphans affirmed that they wished they were dead.
In the United States, there really is the growing recognition of post-traumatic stress disorder and depression and the effect that that can have on a person. And those psychological illnesses, mental illness and depression, really do create a huge issue for AIDS orphans. Depression leads to lower incomes, higher rates of sick day usage, and over the course of a lifetime, a depressed person will make $300,000 less than a non-depressed person.
China issued like a guidance regarding stressing protection for orphans in 2010, creating an initial basic welfare, treatment, recovery, education, employment, and accommodation protection mechanism. China also established a free mandatory education and family subsidy system for families undergoing economic difficulties, further stressing rights protection and guaranteeing access to education for children impacted by AIDS. In Africa, as early as 1991, the government of Malawi established a national orphan care task force. The task force is made up of various representatives and organizations which are responsible for planning, monitoring, and revising all programs on orphan care. National orphan care guidelines were established. The guidelines serve as a broad blueprint to encourage and coordinate regional and community efforts. Establish a subcommittee that is reviewing existing laws and legal procedures to provide greater protection to vulnerable children.
Thank you, Ryan. Now, in the United States, there's some 400,000 AIDS orphans, and most of these AIDS orphans are not cared for by the state, but by family members within their existing social networks. The United States does not provide free comprehensive health care to all children. Rather, it is children who are in poverty who receive aid through state-sponsored health insurance. Some of those protections have been cut recently. However, the U.S. government is required to provide public education from grades kindergarten through 12. If children are handicapped by depression or by other factors, schools are required to provide reasonable accommodation.
So, what can we do to ameliorate these crises? Firstly, new AIDS infections must be prevented so that children do not lose their parents. And secondly, access to the treatment need to be stepped up. And finally, care
has to be provided for these
yes.
kids who are already orphaned.
Yeah.
We really do need to strengthen the social networks that these orphans are in so that they're able to stay within more familiar social networks and so that the trauma is really lessened. I'll tell you about was the China AIDS Orphan Fund. Ryan?
China AIDS Orphan Fund is kind of a non-profit organization. We can find information on the website, on the donation the channels you can find on the website. So this funding will go directly to the orphans who definitely need your help. And also there has a African adoptions website. You can find information if you want to adopt an orphan.
It's similar to Compassion Child, but through providing monetary support on a monthly basis, you're able to make a child's life better.
Yeah.
Through donating, through advocating, and also through educating others, it's possible to lessen the impact of the AIDS crisis and to help AIDS orphans become an integrated